More public education is needed to fully address the issue of the stigma associated with COVID-19. That's from public health specialist Professor Winston Davidson, who thinks this is the one way to fight and dispel harmful stereotypes. Shamela Pullen tells us more in this evening's health report.
Since Jamaica started to record confirmed cases of COVID-19 earlier this year, a number of persons who contracted the virus have recovered. However, persons have questioned the release of some of these individuals from public hospitals given the transmissible nature of the virus. But public health specialist Professor Winston Davidson says after an individual recovers from COVID-19, it is safe for them to go home.
Because it means that the fact that they have recovered would mean that they have, in fact, developed the antibodies against the virus. And this is what, in fact, is keeping the virus at bay and making them feel better. So their immune response would have been quite healthy to respond to the virus, the protein, the virus, which of course is a protein.
Professor Davidson says from his decades of experience in public health, whenever there's a pandemic, there is always going to be stigma. He says this has happened before with most communicable diseases like cholera, HIV, tuberculosis, and syphilis.
People see it as dangerous, and especially if it is a contagious disease, they don't wish to have any sort of contact with anyone with a contagious disease. And it is only a natural human reaction. However, we have seen this with all the pandemics that we have experienced in Jamaica.
The public health specialist says stigma will go away in time, but after persons start to feel convinced that there is a cure or some capacity to eradicate the disease.
The important thing, of course, is that the health personnel and the government sort of give the necessary information to the people to understand that it's not necessary to stigmatize this particular disease. It's necessary to do something about it. And the most important thing to do something about it is prevention.
With your health report, I'm Shamela Pullen wishing you good health.